we have two people that said they couldn't be here.
All right, I think we are live. So
not quite.
No?
No, one more moment. Okay, now you may start.
Thank you. So I will call the meeting to order. We don't quite have a quorum just yet, so we're going to skip our first agenda item since we won't be able to vote at this time, and move to our third agenda item, which is the COVID-19 update. So I will pass it over to Dr. Mahdi.
Good morning, everyone. Good to see everyone this morning.
Morning.
I will be providing the COVID-19 update soon as I can configure my slides. Can everyone see the right screen?
Yes. Yes.
Yes.
So this is the COVID-19 data update, case data as of August 16th. As always, many thanks to our senior epidemiologist, Matt Haslam, for his work in putting these slides together. So as always, I'll start with the St. Louis City COVID-19 epidemic curve that you can see through August of this year. Average daily case counts plateaued at roughly 100 cases per day for nearly 2 months, remaining constantly elevated since the end of May. Fortunately, the average case count is decreasing in August and is down to roughly 66 cases per day. This trend is encouraging, but we may see a rebound after the first few weeks of school. Testing and self-isolation when positive remains a critically important step to protecting others. So we continue to encourage residents to test themselves before and after attending high capacity events, if they have a known exposure to do the same or if they develop any symptoms. So this is the Missouri State Sewershed COVID cases and fragments in sewers data. Viral load in wastewater correlates strongly with diagnoses and is a helpful surveillance tool. The most current data shows viral load peaked in mid-July and has started to decrease. This trend is in agreement with the data I just shared with you for case counts. This is another view of our Sewershed data. We have seen increasing viral loads in wastewater for 2 surveillance sites in the city of St. Louis. You can see those in the red circles on the screen. Of note, the sign at MSD Bissell Point in the city saw a sharp increase in the most recent week, but had been trending rapidly downward for several weeks prior. And the site at South City has a relatively low sample size, which may lead to greater statistical variance. 2 sites in our regions reached a statistically significant elevated viral load, indicating that transmission may still be high in these specific areas. So we're now taking a look at the Omicron variants of concerns. Omicron sublineages BA.212.1 had been the predominant variant in circulation in our region. 2 additional strains, BA.4 and BA.5, have quickly taken over and now represent roughly 90% of all cases. These variants have also been detected in Sewershed Surveillance. The transition from the former variant to these 2 new variants is what we believe is contributing to the sustained high level of infections. So let's look at the CDC community level metrics. Currently, the city is in the medium risk category for the CDC's community level metric due to a drop in the number of daily cases. Hospitalization remained quite elevated across the region, which is my area of continued concern. But hospitalizations are a lagging factor, so it may take some time for admissions to decline too. Residents need to weigh their personal risk, take precautions as necessary. In addition to getting vaccinated, we really need to focus on boosting in our region right now. Wearing a face mask when indoors and around vulnerable people, social distancing, practicing good hand hygiene, improving ventilation are all great strategies for reducing the risk of infection. COVID-19 case data by ward and neighborhood is what you're seeing before you. So the brightest spot by far can be found in the Central West End. Proximity to BJC hospital system is likely contributing to that bright cluster because of the routine testing done at larger institutions. We've seen a considerable drop off in people getting PCR testing in our region. Universities similarly test students and staff frequently, and SLU's campus in Midtown will be an area to keep an eye on as school goes back into session. So let's look at case 19, case demographics by race. Currently, Asian residents have had the highest daily case rates at 20.9 cases per 100,000 per day, followed by African Americans and Caucasians at roughly 14 cases per 100,000. I started some outreach to Asian and Pacific Islander leaders in the region, and will continue to do so to make sure that they're aware of this change, which is the first of its kind for the city at a sustained level in this population. All races have experienced a decline in recent weeks, which is an encouraging trend. But an important note that race is currently unknown for 28% of cases diagnosed, which complicates analyses of trends by racial groups. So these rates should be interpreted with caution. Health equity can only be achieved when we can ensure reliable data for all, especially the most vulnerable amongst us. At the next board meeting, I'll be making a presentation on our new policy at the Department for Health Equity. Hired an epidemiologist fully dedicated to health equity. So more on that in the future in our efforts to make sure that we are leading by example for the region. So let's look at case demographics by age. Rates have dropped for every age group in recent weeks, with age group 0 to 4, 25 to 44, and 65 plus seeing particularly steep drops, though ages 25 to 44 still have the highest daily case rate at 24.3 cases per 100,000. These rates don't reflect unreported cases such as those who test positive with at-home antigen kits. So let's look at the peak inpatient census projection scenarios for the St. Louis Hospital. Recent hospital data indicates a clear downward trend in the inpatient census across pandemic task force hospitals. Hospitalizations are now decreasing quicker than even the most optimistic prediction from BJC Center for Clinical Excellence, which is highlighted in the light blue curve. The inpatient census is still much higher than our target, but this is a good trend that we hope to see continue in the coming months. So let's look at St. Louis City COVID-19 deaths. Fortunately, COVID-19 case fatality rate has fallen over time due to the improved immune protection conferred by vaccines and natural immunity from prior infections. This decoupling of cases and deaths can be observed when we compare the Omicron wave this winter to the number of deaths during the Alpha wave, aka the B117 variant over the previous winter. There were fewer deaths as a result of the Omicron wave, despite having a far greater number of cases diagnosed. We've seen very few deaths over the past 4 months, despite being in the CDC's high community level for much of the summer. So now let's move to vaccination rates, those initiated, completed, and boosted. The number of first, second, and third doses being administered has decreased to a slow and steady pace, but overall vaccination rates have improved to 60.5% fully vaccinated, and nearly half of those received one booster. So in other words, 30% of the total population is boosted. This is a significant increase. When I last met with you, we were just above 25%. And I really want you to know that we've been intentional about our vaccination efforts. We've been focusing on partnerships and a few other initiatives that I can talk about later. So very proud to see that high. We need to see it much higher. Fourth dose is recommended for older adults and for those who are immunocompromised, and this recommendation will likely be extended to the general population as the reformulated Omicron-specific vaccines reach the market in the coming weeks or months. When we talk about fully vaccinated, and those that are age 5 and above by geography, zip codes in North St. Louis continue to lag behind Southwest zip codes and overall vaccination initiation rates. Previously, area with the overall lowest rates had the greatest improvement, but this observation isn't true anymore, which means the gap in vaccination rate is no longer on pace to close. Generally, though, rates of vaccination have been slow, with the greatest improvement being less than 1%. This is likely due to the fact that a majority of people who are already fully vaccinated. And let me make a clarification there. The CDC has updated their guidance to differentiate between up-to-date vaccinations and fully vaccinated, right? So fully vaccinated includes boosting. Those who aren't fully vaccinated have likely been exposed to the virus and developed natural immunity, and as a result may perceive their risk of serious illness to be low, which is incorrect, which is why education and, again, encouraging boosters continues to be critically important. Let's talk about vaccination in school age. That's a 5 to 17-year-old. Currently, 51.1% of eligible school age children have received at least one dose. 44.3% had completed the primary series. Only 10% have received a booster dose, but that criteria was only expanded not too long ago. So this will be a focus for us as schools open, partnering with schools, as you saw us do at this time last year. Children living in predominantly African-American zip codes have a much lower vaccination rate. 25.6% have completed the primary series compared to 63.8% in predominantly Caucasian zip codes. I must again impress upon you that this is a much higher disparity than in most places in the country right now in my conversation with White House task force leaders. Severe disease is rare in children, but inequities in vaccination may exacerbate other health or socioeconomic developmental inequities, compounding disadvantages. Specifically here, we want to keep kids in schools. We know this is important for their development and for their behavioral health, and them continuing to get COVID will severely put them at a disadvantage in this area. So again, I continue to meet weekly with school leaders. We just recently updated our COVID guidance for schools. We're one of the only regions that does this. We specifically write policy. It's something I instituted when I started last October for the schools to give them guidance around this. And the CDC recently made some updates around quarantine, as you may or may not be aware. So we have just updated that. Our website will be updated today to reflect those changes. So a new vaccine is available. Let's talk about Novavax. I don't even know how to say it correctly, but it's Nuvaxovic, I believe. Manufacturer Novavax has a new vaccine available on the market after FDA approval. The vaccine is a subunit protein vaccine, which is the traditional way of developing vaccines. Small pieces of the virus that are not sufficient for transmission, so cannot make you get COVID, are introduced into the immune system. For SARS-CoV-2, this is the spike protein, which helps the virus to enter our cells. The main difference between this style of vaccine and the mRNA vaccines is that the spike protein fragments are produced outside of the body and then injected in the shot, whereas mRNA vaccines use your body's own cells to produce the proteins. This is a 2-dose series and has been approved for adults aged 18 years and older. We look forward to having that available for our communities soon. So let's talk about the CDC guidance updates that I alluded to earlier. CDC has issued new guidance on August 10 to streamline efforts. Some highlights of the change include removing the recommendation to quarantine when you are a close contact of someone who has COVID, except in high-risk congregate setting. Instead, the CDC recommends that people who are exposed should wear a high-quality mask for 10 days and get tested on day 5. Clarified that if you do test positive for COVID-19, you should follow isolation guidance regardless of vaccination. So regardless of your vaccination status, you should follow all of the isolation guidelines. And again, this will be updated on our website today. For school guidance, they removed the recommendation to cohort in schools. You no longer need to conduct broad routine screening and instead focus on high-risk activities, especially during the high COVID-19 community level or in response to an outbreak. They removed information about test to stay, as it is no longer recommended, and they added information about when to wear a mask, managing cases and exposures, as well as responding to outbreaks. I will stop there and take any questions.
Quick question, Dr. Maddie. Thanks for the data. With regards to the low percentage of African-American kids who've been vaccinated, does that correlate with kids vaccinated for other infections, measles, mumps, rubella, others?
That's a great question, and it's a great segue into one of the areas that we'll be focusing on. I think many of you are aware that there's some cities like New York that are seeing polio in their sewershed. Overall, there's a New York Times article that was published yesterday, I believe, that speaks about the overall decline in immunizations, childhood immunizations that the WHO also recognized. And so while I don't have that data yet, Dr. Ross, I think it's important that you highlighted that, and I can ask my epidemiologist to make those comparisons so I can make those available to you. So we'll be starting a campaign within schools to really talk about immunizations in general. My PIOs are working on the first of those messages actually for tomorrow, end of that week, that we'll be sharing on all our social media platforms. We're also working on expanding our communications campaigns more broadly in the way that we have with monkeypox, which you'll hear more about our incredible efforts in that regard during the departmental updates. And so I do think that's an important data metric for us to be aware of and for me to be bringing to the board. So I'll make sure we have those for the next board meeting.
Thank you.
Dr. McNichols?
Dr. McNichols?
Oh, sorry.
Yeah, thanks so much. My question is on the same area of concern. Do we have any sense about if these unvaccinated children live in unvaccinated homes, or are there adults vaccinated, but the children just aren't indicating, it's still concern about vaccine in pediatric population, or is it concern about vaccine in general for these families?
Unfortunately, our data isn't that, we don't have the ability to be quite that specific and granular in our data currently. What I do know is that the zip codes that those children are represented in correlate to the zip codes for the overall lower vaccination rates, so North City and parts of South City. And so one could make that inference, but without actually being able to get to that level of granularity, I can't say with a degree of certainty. Again, I'll speak to my senior epidemiologist, Matt Haslam, to see if we have that capacity, and if so, I think that would be important information to have.
Yeah, thanks. I didn't expect that we would have it yet, but I wonder, it could certainly change our approach to trying to increase vaccination, right? If we think about family events as opposed to.
I agree strongly, Dr. McNichols. I agree strongly. And like you said, especially since right now we're dealing with such significant and understandable pandemic burnout and fatigue, which is limiting our opportunities to really see an uptick, especially in boosters. Like, people are just tired of vaccines in general, tired of anything COVID related. We have to get really intentional and specific and innovative about how we deliver those vaccines.
So I have a related question, because I'm thinking about, I understand that we're making the policies for the school districts, and I don't know if it's up to the schools to then communicate to parents what the changes will be, or if the health department will have material and messaging that's directed at parents and caregivers. But because it is the beginning of the school year and we're looking at vaccinations in general and just kind of back to school readiness, I wonder if us or school districts are using that as an opportunity to talk about vaccines as a part of readiness for school. So not just the ones that are required, but the COVID vaccines as well.
I love that idea. We've been intentional about focusing on updating guidance so that we give schools the best tools to be able to protect kids right now, especially since the CDC dropped this change on us so close to the school term. And then, like I said, me and my PIOs had a conversation just as recently as Tuesday around this immunization campaign that we want to start. But I just like your degree of specificity in thinking about this. And then the third element, again, is that I meet weekly with school leaders. So I think you have brought it together nicely for me, where in our next weekly meeting, which is Wednesday at 8 a.m., we can really talk about a partnered, sustained campaign around immunizations. What we're doing with monkeypox right now is English and Spanish pamphlets, toolkits that are available on our website so that anyone can download them and use them in their area. We also printed out 20,000 for SLPS for their big school back to school segment. So that type of blueprint we can do again for childhood vaccines and make sure that we have a sustained campaign and really be preventative and not wait for the same fate that other cities, regions, both nationally and globally are experiencing around this unfortunate resurgence of disease that we have absolute protection for And we cannot go back there. So I can't agree with you more, Serena. I think an intentional, sustained campaign that's bi-directional between the health department and schools, and being really focused on how we can reach parents outside of sort of a passive approach of relying on them will be great. So I'll work on that with them this Wednesday at 8 and report back to this group at our next board meeting.
Thank you. Any other questions or comments on this topic? Okay, it doesn't look like I see any hands up. So thank you, Dr. Mahdi. We will circle back to our previous agenda item. We do have quorum. So I'm going to ask for a motion to approve the Zoom video from July 21st as our minutes.
So moved.
Can I have a second?
Second.
All in favor?
Aye.
Aye.
Opposed? Abstentions? Okay, motion carries. Thank you. All right, so I'm going to give a very brief update. At our last meeting, we talked about the desire to create a resolution to support reproductive equity. And Linda has offered to draft that resolution. She's not able to be in the meeting today because she's with her son getting him moved into college, but she has been looking at examples from other cities who are also doing something similar to this. And her intent is to have a draft for us to review by the end of this month or early September, so that by the time we meet in September, we'll be able to actually vote to approve that resolution. So be on the lookout for that draft within the next few weeks so that we can provide any feedback or comments via email throughout the drafting process so that we have a final document ready for our September meeting. Any questions about that? All right. So we're going to go to our board committee reports. And before we go to each committee report, I want to remind everyone that for new board members, we really need to have the orientation completed. Much of our work and activity happens at the committee level, and we haven't assigned people to committees who are new because we haven't completed the orientation process yet. So that's an important part of joining the board and contributing and being active. So we have 3 committees that, if you've noticed, every month they're kind of in a holding pattern, waiting for new members and waiting for their activity to resume. So I'm going to ask, if you are a new board member who has not completed orientation, that you take this opportunity to share your availability in the chat so that we can actually get this scheduled today. Because whenever we say we're going to try to email after the meeting, it kind of falls through the gap and we don't get it done. And I think it's been a pretty fair amount of time that we've been trying to accomplish this. So hopefully today we can actually get that scheduled, and then we can start assigning folks to committees and resume our work. So that's my request to everyone in the meeting. So I will turn it over to see if we have a report from governance and nominating. I know that Linda's not here, but sometimes she assigns a committee member to give an update. And I think maybe Paul is going to give an update, but if you are speaking, you're on mute.
Oh, on mute, sorry. Yes, we did not meet last month because I guess Rhonda and Luis, that's 2 members in our committee, because summer is busy. So we don't meet, but we are, basically we are still looking for members joining each committees. Each committees are needing more help. So any new members want to volunteer first, be great. So that's all I have.
Thank you, Paul. All right. Academic Public Health Collaborations Committee.
I think that's probably me, and also Craig and Will are on the screen, I see. So I don't have any update from I gave an update last meeting. We haven't met in the meantime. I'd be happy to we'll continue to work on the efforts we talked about, and we'd be happy to have somebody join our committee who's interested in this topic. So that's a shout out.
And the Health Communications Committee, I know, has not met, and Lisa is not here today. I think she's on vacation as well. All right, so let's make this the last month that we have no reports from the committees, because we're all just so busy getting things done. All right, I will turn it back over to Dr. Mahdi, who has been very busy, to give the departmental updates.
Thanks, Serena. I said it about 3 times muted, so just know I thanked you more proximally to you speaking. So I'm going to start the slideshow, and I need you guys to know that it's hard to offend me. So I would like feedback on whether or not, are you seeing the screen with the notes or the slides?
Slides only.
Slides.
Okay. Yeah, so it's hard to offend me. So if you guys could let me know, as this is only the second time that you've seen this new format for me for this monthly report that I've generated now for the Board of Health, the Mayor's Office, and our stakeholders. For the Board of Health purposes, if you just let me know which information you'd like to see, you would like not to see if it's too long, just so that I know. We have a lot of things to report to you, so I want to make sure that it's not taking up too much time. So let's start with emerging issues, and we'll start here with monkeypox. So this is the part of the report where I talk about high impact items that are currently top of mind. So as of August 16th, there were 8 confirmed cases and 3 possible cases in the city of St. Louis. I can tell you confidently that we do have 11 positives though since then. The Department of Health is actively monitoring the situation, as well as sharing educational materials that can explain the symptoms of monkeypox and emphasize that it is a health concern for the community. So we published a monkeypox information page on the city website. I'll ask one of my PIOs to put that link in the chat for you right now. It's phenomenal. We have national data as well as St. Louis City data. We have information around signs and symptoms. We have current news reports around monkeypox. But most importantly, we have what I'm most proud of is we announced an anti-stigma campaign around monkeypox, as well as a sustained campaign for information that is informative, but also culturally sensitive. We have a toolkit on our website that you can link to and get all of those materials for your clinics, your health centers, your homes, your schools, and communities. It is now being used across multiple counties and has started to get national recognition. I really want to highlight my communicable disease leadership, Suzanne Alexander, Valerie Newborn, and Tyrell, who is actually taking the lead on the anti-stigma campaign. We had a town hall on Tuesday that had over 80 participants. It was very well attended, and we got only good feedback, which is, amazing. One of the things I'm proud of is that, I'm very intentional about sustained communication with the community. I've had a few of these town halls. We've broken our own records as far as participation. I make it a point to highlight staff and not just myself. We bring data, and this information in the pamphlets was very well received. Prior to the town hall, in partnership with the mayor's office, I was also intentional about having meetings with the leadership of the LGBTQIA+ community, given some of the stigma and misinformation and disinformation around monkeypox being a gay disease or a sexually transmitted infection, which it is not. And so that was a 2-hour discussion. We were only slated for an hour and a half, but the discussion was so rich. And then we convened now a list and a listserv of those folks that also get information from us. and for whom we can do direct outreach, and they've been giving me specific feedback. Lastly, we have been doing outreach, in-person outreach, because we know not everyone has access to a website or to a virtual town hall. So my communicable disease staff have been hitting the road literally with our pamphlets. We have information in English and Spanish around monkeypox, around specifically for immunocompromised folks, and again, with a lens of anti-stigma. What else do I want to say about this? I have been trying to make myself available at a national platform to highlight all of the work we're doing in St. Louis, but to advocate for more vaccines, because this is top of mind. Unfortunately, because at a national level, we did not get enough stock of vaccine early enough. States like ours that have lower case counts have had lowest vaccine. We advocated with our county partners, and we're able to work with the states to get the highest number of vaccines for a region in Missouri here for the city and 3 other counties with 1,900 vials. So all that information was made available at the town hall. If you need to see a recording, it is available, but that is one of the main emerging issues. The second one is, as you know, we recently had extreme flooding here. The Department of Health rose into action immediately. We gave 5 of our staff volunteered of their own time. We also gave 2 full-time epidemiologists, and Kim Vandenberg, our public information officer, was available full-time. And when I say full-time, Kim was putting in routinely 16-hour days, 7 days a week during the flood time, and we just want to thank her for her service. The Department of Health also performed public health assessment in impacted areas to identify potential threats. And one of the things we did was also have a sustained campaign around safety measures, around mold, general safety, but specifically around behavioral health. We saw North City, which is minoritized, which has significant health disparities, severely impact. And when I did my own personal canvassing, just so that I could get an assessment of what was happening in flood areas, and I spoke to folks in their homes, it was clear that there was a lot of trauma. And so I reached out to BJC Mental Health, and they immediately sprung to action, in addition to the work they were doing in the region to provide pods and to come to the MARC events, where the one-stop shops for support during the floods. They gave us, I asked them for canvassers. I wanted people who had hit the ground to specifically speak to behavioral health, give people numbers they can call, we had BHR providing group counseling, which is really unprecedented. And I have follow-up meetings with the Department of Mental Health next week to give some of our qualitative data from that, so that they can advocate for further funding to continue sustained behavioral health response for flood victims. I'm extraordinarily proud of the work that the department did. I also want to highlight Justin Hauser, our emergency preparedness, who took a leadership role in incident command. Last and not least, we talked about COVID-19, which continues to be an emerging issue. So I will move now to just share with you some of our violence prevention efforts. This is Epidata through July, and we've given percent change from prior month as feedback that we got from our fearless leader, Serena Mohammed. And so in the last month, we had 16 potentially violent interactions interrupted. Unfortunately, this was a little bit of a decrease from the former month. We've also seen 103 high-risk individuals under case management overall. That's an increase of 6%. We also saw 6 community events around violence prevention and 65 referrals for employment, housing, or financial aid, and that's a great increase there at 3%. We have a comprehensive overview on our website for this data. Behavioral health, I will be debuting our new Behavioral Health Bureau within the next 6 to 8 weeks. I have partnered with the CDC after a very successful visit with the director for the CDC earlier this year. And we have hired, I'm very, very thankful to be able to report that we have hired 6 high-level CDC employees to come and get our behavioral health bureau off the ground. We have folks who do implementation strategy, a data analyst, we'll have epidemiologists, We will have an overall program director and 2 other folks that will round that out to work on strategic planning and a framework for implementation using data, a data-driven approach and a lens of equity. They'll also be meeting with stakeholders in the region to map out services so that the Department of Health is filling needs and not being redundant, but also serves as a leader in the region around decreasing silos and making sure that people can be linked to care in an effective time. I'm really excited to present that to you, not at the next board meeting, but the following one as we officially debut that. But as we look at epi data for July, we saw 192 emergency room visits for suicidal ideation. That's a 7.3% increase, which should be alarming. We also had 174 emergency room visits for substance abuse and overdose, again, a 2.4 increase. Suicidal ideation and attempts have been relatively flat though over the last 7 months overall, and overdoses show a mild seasonal pattern, which more overdoses in the summer months. COVID-19 induced highs in overdose fatalities are falling back to pre-pandemic levels for white users, but again, disparities exist in the Black community, which remains as high as in 2020 and 21. This is the type of data we'll be responding to with our new bureau. I'll be meeting with the Behavioral Health Network board today at 3, more on that later. Our public information officers and communication outreach have been phenomenal. We've been expanding our social media reach, trying to meet people where they are, and there have been increases across the board there. We did press releases around the first probable case of monkeypox, announcing a bill for creating reproductive equity fund and the flood response as well. I, again, have tried to make myself available. I used to do a lot of media work, as you know, and sort of definitely cut that down, but use my platform when it's important for not only the city, but the nation. And so I've been, doing some work with CNN and CBS to get critical information out. From a fiscal and payroll, I'm really proud to announce that I, in an unprecedented move, advocated to the mayor's office, the comptroller's office, and our budget division, who all worked with me, to hire a professional accounting firm to come in for a 1-year contract to help get our fiscal department in order and to the level that we needed to be. They have started that work and are doing some mapping out and canvassing, and many thanks to Emmanuel Kenny, my fiscal chief, and the fiscal team. We've hired, these are some of the metrics to the left that I'll let you read, holding my staff accountable to really improving organizational infrastructure and monitoring. So some of those things are, trying to keep track of requisitions received and decreasing the days to process an invoice from the time submitted to fiscal. And you can see that we've already decreased that by 30%. And so just really having some sustained KPIs, and we'll be working on that more in the coming months. I have hired, since I started in October, 33 people. Last month, we introduced 3 people, but 2 people left. And again, it's that turnover that continues to hurt the health department. I do sustained exit interviews now, and the #1 reason is salary. Thankful for the mayor for increasing salary in July by 4.5%, but we still have a ways to go for equity. And this is something her administration inherited, and she's committed to improving, and will continue to advocate. Second reason is burnout. And so I'd like to really make a push for ARPA funds to work on workforce development and capacity building for the fall allocations, and would appreciate support from this board in advocating for that. Communicable diseases, we've been actively involved in monkeypox protocols in place, outreach, canvassing, as I talked about. We've added team members. CD is really happy about that, and we've increased education and condom requests for our HIV services. I'll let you just sort of passively take a look at the metrics there, but our completion rate for our communicable disease investigations is 97%, which we're really proud of. We've completed over 5,000 surveillance cases, and again, very active in monkeypox, all phenomenal work. No significant changes in data for the hepatitis B regions, but you can passively read that when I send the report out to this group by end of day today. When we look at chronic disease, we're really focused here on reducing prevalence of diabetes, high blood pressure, and pre-diabetes by reducing barriers to healthy food access and building skills knowledge. Saw a dip in that in the last month, so working with my bureau chief to address that. We're also working to demonstrate an increase in knowledge, skills, and preventative health behaviors through men's health presentations in the city of St. Louis. And so we had an additional 2 in the last month, and we're well on track to our goal of 18 annual events there. We continue to highlight the need for a nurse in our Show Me Health Women program. Again, the lack of equity in pay, especially for nurses, is hindering our progress there. Would really appreciate board support for any connections there. The program provides professional nursing case management services to ethnic minority, low-income women, age 35 and older in the city and 4 surrounding counties. So this is such a critical program. We also include follow-up of abnormal Pap tests, mammograms, and clinical breast exams, which, as you can imagine, are really important right now. We've seen a lot of critical threats to reproductive health since the overturning of Roe v. Wade. And so we really want to fill that spot and continue to work in women's health. Our maternal child health is just a star program in the department. Lead and asthma screenings consistently improving. You're seeing 50%, 40% increase in 1 month alone. We did 6 offsite lead safety screenings in the last month. And just, again, this is a highlight program, and I just want to make sure they get their due note there. I'll leave maternal child health, no significant changes. I will say we had 10 school health community outreach events completed this month with educational services for 80 childhood workers. And the number of immunization audits at school will increase as children return to school. And the feedback that I received earlier will go to this group as well. Environmental health is also working on their metrics. So food and beverages want to reduce food-related illnesses through routine beverage inspection programs. Community sanitation is working to respond to complaints on landlord and tenant issues, as well as to maintain safety standards for visitors to hotel and public recreational centers. So again, we will let you know, and I will tell you that this is where we saw 5 staff members support the July flood response, performing community safety related assessments as well. So this is in addition to the other 5. So DOH was a huge volunteer presence for flood response for the city of St. Louis. Animal care and control, we saw service requests for bites and service requests for enforcement of animal ordinances increase significantly. We're continued to provide animal control services for emergency situations, that's bites, police calls for service evictions with, and this is still in the setting of a significantly reduced staff level. So while we have hired folks, just you need to remember that the training period for animal care and control is much longer. And so we will see the benefits of that in the upcoming months. Accreditation efforts continue. We have a new quality improvement plan that's been implemented. The plan includes 9 major QI projects for the next year that will ensure we meet and or exceed the standards for accreditation. Projects include developing an administrative toolkit for managers, improving onboarding process for new employees, developing a training plan for our grants administration program, developing a succession plan for key departmental positions, improving time to abate landlord or tenant issues, increasing lead poison screening, and developing a system for tracking data sharing amongst others. Lastly, in the report, you'll see all of the events where either I or my staff will be promoting public health in the community for the remainder of August and all of September. So I will stop there. Again, I'll distribute this to you by end of day so you can take a more detailed look. You will have with it multiple other reports that will give you an even deeper dive into certain sections. So that'll be for communicable disease and a more detailed monkeypox report amongst others. I'll stop there and take questions, and happy to take honest feedback about the quality of this presentation, changes you'd like to see, and anything else. Thank you.
Dr. McBride.
Thanks, Dr. Mahdi, and thanks to your staff and everybody who helped pull that together. When we see things like this, I know you have boundless energy, so I sometimes think a lot of it's you, but I know that you have a great staff filling out those reports. So just a couple of quick comments. I love the format. I love getting all this information. I'm sort of I like getting things through a fire hose. So one comment I was going to have, you said you were going to send it out later. So I think there's so much information. It's very data heavy and it's very content heavy. So I think it's great if the board can review it in between meetings. So I was going to make that suggestion. You already thought of it. And I think it's great to have this broad, I've been making this point for a while. We've been so focused on COVID that there's so many other parts of public health that I'm glad you're focusing back in on this. And then the final comment, I know you mentioned that you were kind of on the media a lot, as we all know, before you took this position. And I just want to give you a shout out for doing that. I think it's, I know you have so much on your plate in what you're doing in your regular job, but I think it's important for the city and it's important for public health at large that you continue to do this. And again, I don't know where you get all the energy, but I just applaud you for doing that and continuing to do that.
Well, Dr. McBride, I hope it's not too much to say, and thank you so much for your feedback and consistently being supportive. I think that's the one thing I truly appreciate from this board, is that I'm a health director that's very much supported by my board, very much supported by the people in the city, as evidenced by these really healthy town halls we've consistently had. But I must say, and it's a shout out to the fact that I am a woman of privilege. I have a partner who affords me the opportunity to work in this way. I have 2 young children. A lot of women, including my own staff, don't have that level of privilege. So we've had a long way to go towards equity for women in workspaces and just in general. And in regards to me being on the news, I want you to know that I think people probably assume that I really, I like the attention. It's very cringeworthy to be on the news. It's very cringeworthy to hear yourself speak. And I try to be really intentional. So you'll see my staff have been in the media more. I really make sure that they get the opportunity to get media training and to represent the department. But when I have the opportunity, I'm very tactical and intentional about, saying, okay, sorry, I haven't been making myself available for a few months, but I will do a CNN spot or a CBS. One, to put our health department on the map, and strategically for state and national partners to see us as a force to be reckoned with. Doing that has really, we have gotten from the CDC since I've started doing that at a national level, support for opioid crisis, for staffing, and for other people. So I want people to know that there is intention behind it, but that unfortunately I cannot honor those requests at the level that I used to, because the work is plentiful, as you see, and must be prioritized. So thank you for that feedback. Dr. Ross?
Yes. So question regarding the violence abatement, and I'm sorry, I'm going to have to break off in a couple of minutes to see patients. I'm curious about where we are with Cure Violence. How long is our contract? What's your assessment of the impact, their impact on violence abatement, since we've
I just love that, Dr. Ross, you always have an eye for the important questions. And, I sometimes feel like I'm talking too long, so I'll rush over certain slides. So let's talk a little bit about the violence prevention slide. The number one thing is, when I came here, I reported to this board that of the 3 priorities that I outlined, there wasn't one person highlight well, 2 of the 3. There wasn't one person hired by the health department or a bureau dedicated to those priorities. Those 2 were violence prevention and behavioral health, right? My 3rd priority, bring chronic disease, and we have some of that scattered throughout the department, but I'd like to see a section in the future that's dedicated fully to that. So in doing an assessment, it was not going to be possible for us to do the work that was needed if we continue to primarily subcontract and contract out all of that work. Cure Violence being one of our main partners for violence prevention, and in behavioral health, BHR. But that is not a full and holistic way of addressing those 2 priorities in the health department. So I met with the mayor's office and brought to them my suggestion that, much like other health departments in the nation, we deal with violence prevention in a much more collaborative way in the city by opening up an office of violence prevention. Mayor's office did a lot of research around this, was very supportive. And as you know, that was announced last month. We now have an office of violence prevention that feeds into public safety and the health department. That really gives us an opportunity to have directed efforts. Will Pinky is a great partner to me. We meet every 2 weeks. And so Cure Violence falls under that office now and continues to do great work. We also, again, provided a full-time monthly report that Matt provides. And lastly, we got additional funding through this Office of Violence Prevention and did an RFP where we were able to fund fully. Craig, are you on? I don't want to get this wrong. I know we had 17 applications, but we funded, was it 7 to 10?
8.
It was 8. It was 8. Thank you, Serena. We funded 8 groups and with the lens of equity, Dr. Ross. So understanding that a lot of smaller groups are not able to even apply for RFPs because they don't have capacity, they don't have people on staff. They oftentimes don't meet the requirements. So the mayor's office, of their own volition, hired a contractor that would help the smaller organizations understand the RFP process and help them. So there was equity between, we saw organizations fully funded around violence prevention efforts that hadn't been seen before. So there's also a program that Will Pinky can come back and speak to. I've invited him here previously around supportive reentry that is also falling under that office, and you'll see a lot more under the Office of Violence Prevention specifically. The contract for Cure Violence was extended for another year underneath that with some, with actually increase in budget that we prioritized based on feedback. I went and met with Cure Violence leadership and staff. Will did the same when he came into the position, and Serena has been consistently assisting us there with the advisory board that she had set up and in partnership with Department of Health, and all of that work has really gone into trying to increase efforts there. There's a lot to do, but I think with a dedicated Office of Violence Prevention, Dr. Ross will be better served to really have a more holistic and full approach to violence prevention in the city. Does that help, Dr. Ross, and any feedback?
Kudos to you, Serena, and all involved. That's absolutely the approach that I was hoping we would take, a much more systemic, collaborative approach. That's just wonderful news. Thank you.
Thank you. Dr. McNichols?
So just quick feedback on the format. I love it. I love seeing sort of the short snapshot of all the different areas that the department is working in. Thinking about the ways that I, as a board member, can help support some of those efforts. Can you tell me a little bit more about the need for the nurse and the women's reproductive health program? You specifically said they follow up on things like Pap tests and mammograms. Yeah. Who is performing?
So hiring nurses has been a consistent battle for us. The inequities in pay between government employees and people in the private sector is much larger in the nursing sector. Most nurses, I'll tell you that the nurses we do are basically volunteering. I mean, they're taking such a pay hit from anywhere else that they would work. So any innovative strategies for us to be able to fill that position, and I can put you in contact with my bureau chief who can give you a much more detailed report about exactly the type of nurse he's needed and the services. And if there's ways that we can either partner through a contract, an MOU, or just in helping us to fill that position, knowing though that again, the salary is not competitive. I just think it would be a great asset to the work that the health department is trying to do around women's health in general and for the region. As you know, though, the Reproductive Equity Fund that was announced through Board Bill 61, that RFP will be going live, we hope. I mean, the NOFA for that will be introduced hopefully by end of next week too, and that will help in those efforts as well. So Dr. McNichols, if you're interested in supporting it specifically there, I would love to put you in contact with Bobby Williams, who's the bureau chief, to really talk about the needs and then maybe see what the board or yourself specifically can do to support that effort.
Yeah, that would be great. I mean, we have an entire centralized follow-up unit that I think we could probably, at least in the short term stopgap, provide maybe some support from our end. So that would be great if you would connect me.
That's wonderful. Do you see how this format's already helping with collaboration? And Serena and I have been really trying to push for better feedback, but a lot more support. And I've really seen the change. So I'd like to thank this board for really upping the level. I think we're exemplary and probably to be emulated, not just regionally, but nationally. So thank you all. Any other comments or questions?
Okay, I don't see any. So thank you, Dr. Mahdi. All right, so we're very near the end. I don't think we have any old business. Are there any announcements that folks would like to share with the group? announcements about initiatives, events, activities? Dr. McNicholas? Or is your hand still up from the previous?
Yeah, sorry, that
Okay. No problem. All right, it doesn't look like we have any announcements. So you don't actually need to have a motion to adjourn, just for folks to be clear about that. So I'm going to adjourn the meeting, and I look forward to seeing everyone next month.
Thank you.
Thank you.